Hello students, in this video we'll be discussing about drugs for mania and bipolar disorder. So first we'll understand what is mania and when to call it as a bipolar disorder. Increased energy, decreased need of sleep, racing thoughts, we'll do call it as a phase of maniac where it reaches the peak of the maniac. Followed by if it is reaching to the normal and if it is going down again where there is low mood, loss of interest, fatigue, poor sleep and worthlessness and all, it's called as a peak of depression. So this becomes a cycle and it becomes a continuous phase of this cycle. So when there is a mood which is normal, which is called as euthymic phase, when there is a swings of the mood to maniac and depression, it is called as a bipolar disorder. Whereas only and only if there is a phase where there is an elevated mood, increased energy, decreased sleep, racing thoughts, aggressiveness, this phase is called as the phase of mania. So we'll deal with this disorder now. So the main drug which we'll be using for treating bipolar disorder is lithium carbonate. We'll be using lithium carbonate, which was found to be a sedative in animals, which was the initial factor which we have learned. Later they thought of using it in maniac patients as well. So how does it work? The lithium, if you see, so now usually what happens is the sodium will be keeping on moving in and out of the cell with the potassium, exchanging with the potassium, generating nerve impulses. Whereas if we inject lithium, the lithium will be arranged in the equal quantities outside and inside the cell, and there will be hardly any movement within and outside the cell anymore. Therefore, these aggressive impulses which are being generated till now, which is leading to the elevated mood, which is leading to the mania till now, which will be suppressed by this phenomenon by injecting lithium or by administering lithium. So the second theory which says is that it blocks the release of noradrenaline and dopamine from the presynaptic neuron, and lithium will promote only the release of serotonin, which is also one of the theories which says that lithium can be used for bipolar disorder. And lithium also plays a major role in inhibiting the enzyme. It inhibits the enzyme called as inositol monophosphatase, which will further prevent the conversion of or the breakdown of inositol 1-phosphate to inositol. So just remember these two names. Inositol 1-phosphate will be prevented from breaking down into inositol, so that this IP3-DAG pathway won't be happening. If IP3-DAG pathway happens, excessive impulses that will be generated with the intermediaries that will be formed. So after giving lithium, there will be no IP3-DAG pathway, so that this excessive signaling won't be there anymore. That will help in reducing maniac. So how this theory also has a major role is because only the neurons which are hyperactive in maniac patient will be needing this IP3-DAG pathway, and they'll be needing more of inositol. The neurons will be needing more of inositol for their functioning. So if we block this production of inositol in these specific neurons, they'll lead to the treatment of maniac disorder. So also the same mechanism of action will be followed by sodium valproate, which we have learned in anti-epileptics chapter. So blocking of this enzyme, same enzyme inositol monophosphatase by sodium valproate, also gives the same reaction by blocking the IP3-DAG pathway. So and lithium also has other actions, and these are many things which we have to learn from lithium. I've tried to simplify this with this easiest mnemonic which we have. Lithium, remember, leukocyte count will increase. The body will feel lithium to be a foreign body and it will just increase the immunity against it. So the leukocyte count will increase. Lithium mimics like insulin, or it will behave like insulin, and it will alter the glucose metabolism just like the insulin. TH, you can remember it with the thyroid, so it just blocks the thyroid hormone release. So the pituitary gland will keep on pushing it from above by releasing thyroid stimulating hormone, so that the thyroid gland will be hyperstimulated and it will just enlarge in size because of the signals coming from the high command, that is the pituitary. So it becomes into a phase of goiter. In patients who are taking lithium, mostly there will be a case of goiter, not in every case but in some cases. So you can remember this to be a nephron, and you can remember this to be a distal tubule. It has ADH preventing action, like IDH action won't be acting on the distal tubule. Adverse effects. So the lithium has a very narrow therapeutic range, which means if you give any dose which is less than required, it won't work. If you give just a minimal dose above the required, it will give you a toxic adverse effects. So we have to maintain the range, the serum range of lithium within a particular limit. Only then we'll be able to have the therapeutic response properly. So what happens if there is an increased serum level of lithium of more than 2 milliequivalents per liter? We call it as overdose. Usually, just remember what happens is, in our body there is sodium which is already acting. We know what is sodium. We'll be having sodium ions in all through our body. Now we have administered lithium also. So they'll compete for the things. Usually sodium, we will find it in the neuromuscular junctions, neurons, muscles. Every activity is based on sodium activity, right? So if that is interfered by the lithium, there will be cause tremors because neurons and the muscles are affected, motor incoordination, slurring of the speech, there is no coordination between the muscles, and all of these causes mental confusion. There will be nystagmus in the eyes, muscle twitchings, convulsions, delirium, and ultimately might land up in coma if the dose is overdosed. Also, the same condition might also appear in the fetus also. So if you give the lithium to a pregnant lady, it is very dangerous. It might cause goiter in the developing fetus also. If the same fight happens like between Na plus and Li plus, which will lead to the cardiac arrhythmias if they act on the heart muscles. So what is the treatment for this lithium toxicity? If I overdose, what should I do? Nothing, because there is no antidote, and what we can do is we can just give osmotic diuretics along with some sodium bicarbonate. That will be the treatment. If we give osmotic diuretic with sodium bicarbonate, that will just lead to the excretion of lithium from the body. So what are the uses? These are the uses. So in order to suppress this elevated mood, we can use lithium. It will bring the elevated mood to the normal level, which we call it as mood stabilizer. This will bring down the mood into the normal phase, which is called as a mood stabilizer. Also, if we can give the antidepressant, this depressant activity will be gone. They will be bringing back this lithium, will be bringing the maniac episode down. Antidepressant will be bringing the depression mood back to normal. So combination of these both can help in a bipolar patient to bring their mood back to the normal, and they can live a normal life. If we can prevent this maniac episode from occurring by giving lithium or any other drugs which we will be using for treating mania, this cycle will be interrupted. The normal cycle will be prolonged, and the patient can have a normal life for long duration. For bipolar disorder, we have lithium and antidepressant we can give combination. Also, in a single unipolar major depressive disorder also, we can just give lithium and antidepressant. So what are the alternatives of lithium? Lithium, we have few adverse effects which we have seen, and it was blocking ADH, it was causing goiter in patients. So how to deal with all those things? So lithium, instead of lithium, we have another premium drug which we have, sodium valproate, which is one of the anti-epileptic drug, which was also acting similar to the lithium by blocking the inositol monophosphatase enzyme, which we have seen in the above slide. So this is now considered as the first line treatment for mania because it is faster acting than lithium. And in the anti-epileptic chapter, we have discussed divalproex. It's just a combination of sodium valproate and valproic acid in 1:1 ratio. This can be used for treatment, and it acts fast, it acts like lithium, and doesn't have side effects like lithium. Also, carbamazepine and lamotrigine, these are also the anti-epileptic drugs which can be used for prophylaxis for bipolar disorder. Also, we do have antipsychotics which can be injected during an acute phase of mania. If you see a person who is having an acute phase of mania, try to inject atypical antipsychotics, especially olanzapine, risperidone, aripiprazole, which is found to be the best among the class, quetiapine, along with the benzodiazepine, probably clonazepam or a lorazepam. You can inject IM to the patient who is already having acute phase of mania so that he'll be relieved from the symptoms. After that, you can continue giving the lithium as usual. The lithium will take 1 to 2 weeks to act, so even if you administer it on day 1, try continuing it. For the acute episode to control, just inject these drugs and just continue oral treatment by lithium. It will just start acting later. Or go with sodium valproate. That's it for today. Thank you everyone. Don't forget to like and subscribe to my channel. Thank you.